My name is Langley. I'm a dentist and I'm one of the co-founders and chief executive of Apolline. And we set Apolline up in 2010 when the CQC was coming, with the aim of providing bespoke, hands-on support in all matters relating to regulatory compliance. And our aim is very much to make sure that all this quality and compliance stuff we have to do in our practices creates business benefits rather than distracting you from the task of looking after your patients and creating the revenue to enable you to look after your team and indeed your patients. And we aim to give you peace of mind that you're doing the right thing in the right way at the right time. And I think there's a lot of confusion out there within the profession at the moment. And so we aim to dissolve the confusion and give you peace of mind that you're doing the right things. If you like, it's to avoid the hamster in the wheel syndrome that we see going on in so many practices. And we see ourselves really as a little bit of a shield between the regulators, the GDC, and the CQC. And I think it's true to say there are very few people out there who are delighted and happy with all the regulation we now have to comply with. Few have got steam coming out of their ears, and hardly anybody really is over the moon about it all. But I think a lot of people have this big question mark over their heads. Are we doing the right things, and are we doing them in the right way? And so that's what we set Apolline up to help with. GDC obviously now has its new standards from 2013, which is very, very clear on what all GDC registrants must do. And then obviously we have the CQC and the changes that they brought in on the 1st of April 2015. And these new changes have brought a change to the regulatory regime. So there are two types of inspection now that happen. There's a comprehensive inspection and there is a focused inspection. 10% of practices will have a comprehensive inspection in this year 2015-16, and focused inspections will be in addition to that. Comprehensive inspections will take 1 day, they will be thorough, and they will be undertaken by a CQC inspector, and usually that inspector will be accompanied by a dentist. You'll have 2 weeks notice of your CQC inspection, which is good news. The bad news though is that if you haven't done everything you need to do for your inspection, 2 weeks is not anywhere near enough time to prepare. When the CQC inspector comes to your practice, they will speak to everyone. So they'll speak to dentists, not just the principal, they'll speak to associates, they'll speak to the practice manager, they'll speak to receptionists, dental nurses, basically everyone. They'll look at your policies and protocols, and they'll expect those to be tailored to what you do in your practice. The new regulations have a very strong focus on gathering feedback from your patients and indeed your staff. Things like looking at your complaints and your compliments, and a really strong focus now on consent and an understanding of the Mental Capacity Act, and patients' records will be scrutinised. And bearing in mind it'll be a dentist scrutinising them, they will know what they're looking for. And there's been a really big change as well in the inspection regime, where at the beginning of the inspection, practices will be asked for any areas of the regulations that they are not currently complying with, and what they're going to do about that going forwards. Practices will also be asked for any areas in which they are practicing what they call notable practice. So that's practice that goes beyond the regulations. Now, before everybody starts screaming loudly, actually what that means is that you need to know what the regulations say in some detail to be able to answer those questions. How do you do that? Well, there is only really one way to do that. The only way to do it is to audit your compliance. But how do you know what to audit? Well, either you can spend many, many hours working out what the regulations require and audit yourself, or that's what we set Apolline up for. So we can come into your practice and undertake an audit that really highlights all the areas that you're doing really well in and just shows you the areas that you perhaps need to do a little bit of work on prior to your CQC inspection. Now, in the next short video, we'll look at what the standards are. We'll look at the importance of recording significant incidents, and we'll just have a little bit of a think about what sorts of questions the CQC inspector will ask when they come. Thank you for listening. My name's Pat Langley, and I'm from Apolline.